And for more on the efforts by governments to eradicate malaria in the world, let's bring in Dr. Agbor Ebuta, the Vice President of Medical Initiative for Africa. He joins us live via Zoom from Abuja. Good to have you join us, Dr. Agbor. I want to begin from where one of the doctors in that report we just saw left off. She was talking about the implications of self-treatment, and I want to start from there. Talk to us about the severe forms and cases of malaria in the country, and then the challenge and implication of self-treatment.
Well, thanks for having me. Malaria cases in Nigeria are about 97 million based on the 2021 data. That means half of the Nigerian populations were affected. In terms of death rate, we lost about 200,000 Nigerians to death in 2021 and contributed 31% of the global burden. Now, the issue with treatment is that I can tell you for free that most of the people who treat malaria do not have malaria. Because for you to treat malaria, WHO recommends that you should test before treating. Because most people who have fever, headache, or any symptom would go to the pharmacy or chemist and get an anti-malaria. Studies have showed repeatedly and consistently that half of those patients or more do not have malaria. Even patients who have flu, cough, and catarrh will treat for malaria. Now, this has led to several things. Number one is that it has exposed people to medications that they do not need. That's number one. Number two is that it has exposed them to potential adverse drug reaction, like my colleague mentioned, liver, kidney, and other challenges, and even allergic reactions. Number three is that it has also taken these medications when you think you are treating for malaria, delays proper diagnosis and treatment for what you actually have. Number four is that it increases the events and the emergence of resistance to anti-malarial medications, as we are beginning to see, because the abuse of anti-malarial medications lead to due exposure of the parasite and the emergence of resistance, and as we have demonstrated in Nigeria, and evidence continues to emerge. So it's very clear that there is an overuse of anti-malaria due to an unregulated sector, and that has delayed proper access to treatment. Be that as it may, that is not to undermine or understate the challenge of malaria in Nigeria. The current data suggests that 22% prevalence in Nigeria. That would put a number of about 50 million Nigerians at any point in time would have malaria. Unfortunately, this number of people, most of them would not get access to treatment due to cost, access, or the absence of a supportive health system, especially as a result of a weak primary healthcare system. All these are significant challenges and will require, just like this year's
Dr. Ebuta, just sorry to interrupt you. I wanted to ask you, because you're speaking on something quite important and interesting, which is a malaria burden. And I was going to ask you, in line with the theme of the year, which is time to deliver zero malaria, invest, innovate, and implement. And if we were to deliver zero malaria in Nigeria, where should we be investing in? What should we innovate? And then what should we implement?
Well, innovation has to be in the prevention, in the diagnosis, and in the treatment of malaria. Number one, in prevention, we must be more aggressive. Local government chairmen, state governors, and of course the federal government would have to do more, especially local government chairmen. They must improve environmental sanitation, drain all water bodies that are prone to malaria colonization, and expose these water bodies and environment to the use of insecticides and larvicides as necessary. In addition to that, they must provide access to diagnosis and treatment. Diagnosis will require that proper diagnosis using microscopy, and where not available, rapid diagnostic kits, which have been approved by WHO. And finally, there should be medications. The use of insecticide-treated mosquito nets should basically be encouraged. And more recently, innovation in terms of the availability of the R21 vaccine. The R21 vaccine is very interesting. It has the potential of preventing malaria up to 77% within a 1 year period if you take the complete dose in children who are between 3 months and to 3 years. And these are the people that are most affected. But the advantage of that is that if we were to institute it mathematically, if we look at the metrics, if we do that within the next 1 year, we can drive malaria prevalence from 22%, as we have in Nigeria right now, to 5% only from vaccine intervention. And then we can then knock off the remaining 5% with other measures. In addition to that, we need to increase investment. And most of the investment for malaria now is very uncoordinated. But the one that is tracked and there's data for is usually foreign investments from donor agencies and all of that. But that is insufficient for us to put together to target elimination. So investments must come from local sources, they must be sustainable, and we must.
All right, thank you so much, Dr. Agbor Ebuta, the Vice President of Medical Initiative for Africa, who joined us live from Abuja. Let's now turn our attention, let's now take a break, I understand. When we return, we'll bring you business updates. Stay with us.